Hi everyone, I'm Dr. Tan Pin. This is my usual 9 p.m. Sunday live video. Today I'm going to talk about blocked duct, mastitis and breast abscess. So there are three things: blocked duct, mastitis and breast abscess. So for all these three, the similarity is you have a lump on the breast, there's a hardened patch on the breast, and that's why you do not know whether you have mastitis, blocked duct or breast abscess. So the main cause of all this problem is due to blocked duct first. So you have blocked duct, and when the duct is blocked, the milk inside the blocked duct is a good source of food for the bacteria. So when the bacteria get into the breast and go to that area with so much milk inside, the bacteria have a good time having so much nutrient and food inside the breast. So then that's why it gets infected very easily. So when you have blocked duct and you cannot empty it, I tell you, it doesn't take long for the bacteria to come. 1 to 2 days max. 1 to 2 days max. That's why I always tell mothers, 1 to 2 days, if you cannot drain the milk from your breast in 1 to 2 days, then you're going to get mastitis already. Okay? So within 1 to 2 days, the milk will be infected. So once the milk is infected, you need to go on antibiotic. But again, a lot of people delay. Why? Maybe they still think that it's still blocked duct. They always think it's blocked duct. Then they'll find ways. They get people to come and massage, to drain for them. They go and get a lot of people to help them. They go to Google to find ways. They do hot pack, they try to drain, they do everything except starting antibiotic. So one thing is because they always think it's still blocked duct. The other problem is a lot of mothers also, why they never go and take antibiotic is because they feel that antibiotic is no good. A lot of mothers very scared to take any medicine when they are breastfeeding, and because of that, there is a certain resistance to go and see doctor. What if I go and see doctor? Doctor say must take antibiotic. Then they always feel that if I'm breastfeeding, I cannot take any medicine. So because of that, there is a delay. So when you have mastitis and you never take antibiotic, what is going to happen next? The mastitis goes on and on and on. And after like another 3 to 5 days of mastitis, if you do not start on antibiotic, it forms abscess. That's why most of the time when mothers have abscess, they usually will have symptoms for at least 1 week already. Then when they have abscess, there is also another problem. Most mothers with abscess, they will usually end up going to see a doctor already. Why? Because the pain is becoming unbearable. So you will go and see doctor. But what is the problem when you go and see doctor? When you go and see doctor, one problem is that some doctors will say, oh, this is mastitis. Then they give antibiotic. Then you take the antibiotic and your mastitis never go away. Why the mastitis never go away with antibiotic? Because it's not mastitis anymore. Because it's abscess. Okay? Because it's abscess. So with abscess, antibiotic won't work already. So that is the end point. When you reach abscess, antibiotic don't work, then what is going to happen? So that's why this blocked duct, mastitis and breast abscess is always a very sad story, especially on my part, because I always see the other end. I always see the end whereby they come in with abscess. So what should you do? Simple. When you identify one area of hardening, it starts off with blocked duct. You only give yourself 1 to 2 days time. If you cannot drain it out, then it's no longer blocked duct. You need to start antibiotic. Your blocked duct already forming, going to be infected already. So you must start antibiotic after 1 to 2 days if you cannot drain this off. Some people, they can drain. Then tomorrow block again. Then they drain. And then another block again, same place. If you keep blocking back the same place, bacteria is going to come already. Because in most time, the area is filled with milk, which is a good nutrient for the bacteria. So you have to start antibiotic. The most important thing actually in preventing breast abscess is to start antibiotic early. Are there any other signs that you can tell whether it's mastitis or blocked duct? Blocked duct, you ask me, when it's blocked, it's not really painful one. It's just blocked, but there's no pain. Number 1, there's no pain. Number 2, there's no redness. Number 3, there's no fever. If you find it very painful, and also you find you have fever, or you actually can see a pinkish patch, slightly redder than the rest of the skin, this is already mastitis. You must quick go and see doctor and start antibiotic. So now, once you have that, let's say you didn't start antibiotic early, then when is it that you have abscess? You can tell abscess when the skin becomes even redder. It's no longer that light pink anymore. Now the whole patch is red. When the whole patch is red, we have to think about abscess already. Number 2, the pain now becomes worse. Because abscess, the pain is a lot worse than mastitis. So that is one of the ways. But that is not the most accurate. The most accurate is you still need to do an ultrasound scan. I have seen abscesses that's so deep inside the breast, but when you scan, it's an abscess. So you need an ultrasound scan. So what happens is, if you take antibiotics, after 1 to 2 days, it doesn't go away. The next thing you need to do is to do an ultrasound scan. So remember, when you have the first hardening, within 1 to 2 days, if you cannot solve that problem, you need to start antibiotic. You start antibiotic, within 2 to 3 days, if it doesn't go away, you need to have an ultrasound scan. Okay? Because the only reason why it's not going away usually is because already formed abscess. In very rare situations, I've seen some women, they take antibiotic, it didn't go away because the bug that infect the breast is a drug-resistant bacteria. I do see drug-resistant bacteria. I still remember when I was a student, my teacher would say, breast abscess, no need to test, see what bacteria, just give them this antibiotic because it's always Staph aureus. It's always Staph aureus, so the antibiotic must be the right antibiotic for Staph aureus. So as long as you give the right antibiotic, that's fine. But I still see occasionally some mothers who come to me with the wrong antibiotic, and that is why the Staph aureus didn't die. But we know we have drug-resistant Staph aureus in this world. We have drug-resistant Staph aureus in the community as well. So I do see women who come to me with abscess, and if I test the pus, yes, it's Staph aureus, but it's drug-resistant. So drug-resistant is a sad case now because antibiotic wouldn't work. That's why they form abscess. So the only way is to drain the abscess. So when I get the abscess in the breast, what I do is I will put a needle in and I'll just drain all the pus out and send the pus to the lab to make sure that this pus is the normal Staph aureus and not the drug-resistant Staph aureus. So if let's say, and then I will give antibiotics. So after a few days when I get the result, as long as it is the normal Staph aureus, then I will just continue with the normal antibiotic. But if let's say, if I were to take the pus out and the test come back as drug-resistant Staph aureus, then I have no choice but to change the antibiotic. But it's not really a problem. There's usually antibiotics for it, just that you cannot use the common antibiotic for drug-resistant Staph aureus. So that is the one path, the first path of how breast abscess are formed. Then there's a second path. Second path, there's no blocked duct. There's no blocked duct. So what happened is the baby may have bitten the mother. Sometimes baby like to bite. They like to bite the nipple. When they bite the nipple, as I said, there's a wound and the baby's mouth has a lot of bacteria. So the bacteria will infect the wound and this bacteria will go in and cause mastitis. So there's no blocked duct this time. There's straight away mastitis. So in this women, sometimes there's no hardening. It's very soft on the breast, but you can see one patch red. You can see one patch red and it's painful. And painful is also mastitis. So fast, take antibiotic. Because if you don't take antibiotic, it may also be cellulitis, which is also infection of the soft tissue around the gland, or whatever it is, you need antibiotic before it forms abscess, because cellulitis forms abscess. So we do not want abscess. So these are the path how it goes. Remember, if you have a blocked duct, you give yourself 1 to 2 days maximum. If you cannot drink the blocked duct, then you must start antibiotic. And once you start antibiotic, you give yourself maximum 2 to 3 days. If the mastitis does not go away, then you must go and get an ultrasound scan to see and make sure. In my clinic, we do not want to take the risk of whether mastitis or abscess. We scan all mothers who come in with mastitis or breast abscess just to make sure that we do not miss, because as I said, I have seen breast, no redness, but when we scan, there's an abscess so deep inside, that's why the skin is still okay. So be on the safe side, we will usually scan all the mothers. As long as it's not abscess, simple, I just give antibiotic, you go back. But if I scan, if it's an abscess, then I will put the needle in and take out all the pus and start you on antibiotic, and you can also go home. Okay, so I don't usually encourage doing surgery for breast abscess because I think it's very pitiful. I have done surgery like that before. Those days when I was a trainee, I used to be in the department of general surgery, so we do get a lot of breast abscess, and I always feel that doing this surgery on a woman is like such a cruel thing. You really mutilate the whole breast. The breast looks so awful after that. It's some surgery that I really can't, I will never do. So even my patients have 200 mils of pus, one whole cup full of pus, I will just sit there and slowly syringe it out until I clear all the pus. Because I think doing a surgery for breast abscess is a very cruel thing to do. So remember this. So how to prevent? Okay, to prevent, if you're talking about baby injuring you, like biting you, all this, then this can be a bit tricky because babies up to a certain stage may want to bite. But I also have 3 kids and I breastfeed all my 3 kids. They will bite at a certain point, but if you nicely talk to them, every time they bite, tell them it's no, most of the time they will stop. Okay, and there are certain tricks that you can also watch, which are the common time that the baby will bite. So what I noticed, because I have one son that loves to bite me at the point of sleeping. So when I can see the baby, my son almost going to sleep, almost going to go into deep sleep, I will quickly put my finger in so they bite my finger and not my nipple. So there's only one son who does that. My other son and my daughter, even though they bite, but after I say no to them a couple of times, they were quite okay. They just stop biting me. But if you're talking about blocked ducts, there are a few problems that I realized. How to prevent a blocked duct to start off with? Number one, are you drinking enough water? A lot of mothers who are breastfeeding don't drink enough water. As a result, you form milk that are a lot thicker and more likely to block the duct. So how much is enough water? To me, 3 to 4 liters water a day is important for breastfeeding mothers. Why I say 3 to 4 liters? Think about it. Adult human, you are supposed to drink 2.5 liters of water a day. For yourself, you need 2.5 liters. How much milk do you think you're producing a day? Also another 500 to 1 liter. So you're producing so much milk, you need to top up another 1 liter. So if you need 2.5, your baby need 1 liter. You need to drink 3 liters of water. So you see, in general, we know there are certain people, not say women, men or women is the same. They can drink a lot of water. You can give them one whole bottle of mineral water, they can and finish within the next 5 minutes. But there's some people who can't. They can only drink 2 mouths, 3 mouths, they have to stop. They have to drink 2 mouths, 3 mouths, they have to stop. So these people tend to do not fulfill the 3.5 liters of water a day. So you have to discipline yourself as a breastfeeding mother to drink 3.5 liters a day. How to discipline? How to discipline 3.5 liters? Simple. 1 mineral water is 1.5 liters. You fill it up. 2 bottles. Every day you fill up 2 bottles. And these 2 bottles you must drink finish. One you put in office, one you put at home. So you finish these 2 bottles of water, which is already 3 liters. Then on top of that, every time you eat and drink, you will also drink some other water that accompany your lunch, your dinner, your breakfast. Then definitely you have more than 3 liters. So you must discipline yourself. So if you have a smaller water bottle, you must know how much water is that. You put 1.5 liters in your office, put 1.5 liters at home every day. You measure it properly and make sure you drink enough water. So drinking enough water is the first thing. Second thing is regarding the way you pump your milk. I also realized that a lot of women who are who actually ended up with mastitis and breast abscess actually also depend on pumping more than direct latching. That's why I would say direct latching is more important. A lot of mothers, when they struggle in the first 1 week, they just give up and then they just decided to pump milk instead of direct latching, and that is why they ended up having problem with blocked ducts. But other than that, what else can we do? So we must do as much direct latching as possible. If let's say you are a mother that only express milk only, you only pump, then how you pump is again very important. For example, do you pump using your hand, using a pump? We know hand expression is usually better than using a pump. But unfortunately, majority of women still rely on a pump. So when you rely on a pump, you need to think about how to make sure that you can empty your breast efficiently using a breast pump. That is when what pump you use and how you pump matters. Number one, I always feel that you need to pump without stress. You know, of course, before we pump, if possible, we want to put some hot pack, then we massage our breast, and then only we fit in the pump. But we also know that milk comes out because of the reflex we call let down reflex. So if you pump but you're so stressed and you think so much of your pump, even when you're breastfeeding baby, also the same thing. When I see mothers breastfeeding in the hospital, I always push up the head. I say, look at the TV, look at the TV. Don't look at your baby, because you look at your baby, the milk won't come out, you know or not. You're so stressed. You're so stressed. So sometimes breastfeeding, pumping is also important, because sometimes if you're very stressed, you're so concentrated on your pumping, sometimes the milk is also very hard to come out. So the best is, we say if you can get hands-free pump. So that's why I'm here to share with you a hands-free pump that I saw recently. Actually, how I wish I have this type of pump when I was working those days. Actually, I saw this pump I think a couple of years back, and when it was first out in US, and I actually put this post in my Facebook as well. I said, wow, this pump is so nice because it actually fits inside your bra. You can actually wear it inside your bra, and then you can just leave it there, and then you can continue working and do things like that. You can don't care at all, and all the milk will be accumulated inside. So first of all, it's hands-free. It's hands-free. Another thing is very important in breast pumping. The mechanism of pumping, I always say that you need some softer pumping mechanism, because you must understand it's supposed to squeeze your breast and not just suck. So when you have a pump that is softer, then it is actually massaging your breast at the same time when it expresses the milk. Okay? And another thing is, the good thing about this pump is all the milk is accumulated inside, so you do not have a special bottle to keep the milk, because then that's why you can actually wear it on your breast, in your bra, so that it is like part of your breast already. So when you want to remove, it's also very easy. You just have to remove this thing, and then the milk will be inside, and then you just pour it into your bottle or your bag. So this is a breast pump that I found that is, I would think for now, the perfect pump for every mother. So if you want to buy this pump, you can buy it from the website itself. It is under www.supermama lab. So you can buy it from the website www.supermamalab. Okay, supermamalab.com. So you can buy it, and it's not expensive. When I first saw it, the ones from US, it cost thousands. This one only 200 plus one. If you buy two, then it's only 500 ringgit. So if you buy two for 500 ringgit, you put one left, one right, then you can still have a shawl or scarf covering, and you can still continue to work. So it is very convenient. So effective pumping is very important. So if you can pump both sides, it's also more effective than pumping one by one. And not to think so much about your pumping, sometimes the milk also come out a lot easier. And there's a lot of other things that also we need to think about when you pump. Some mothers, they like to wear very tight t-shirt, you know, when you wear tight t-shirt. So it's not just pumping, even when you direct latch, you wear tight t-shirt and you pull out one side of your t-shirt and you feed your baby one side, and the t-shirt actually just go through like that, and it's very tight. So it actually blocks the duct. So the milk over here cannot go through because the duct is blocked. So very important. When you are breastfeeding, you need to wear very loose clothing, even your bra must be loose. That's why this pump, I say, is so perfect because it actually goes in. So whatever clothes you wear doesn't press onto your duct anymore because your entire breast is covered by the breast pump. So that's why I say this is the perfect pump I can think for breastfeeding mothers. So other than drinking a lot of water, expressing your milk correctly to empty as much as possible, direct latching, of course, again, I cannot say that is the most important actually, because even you ask me when I used to work, I do have blocked ducts when I go to work and I pump. But when I come back, I direct latch as much as possible, the baby will just finish up everything. So you need to direct latch, drink a lot of water. I think that is the key, most important thing. And one last thing, I also noticed that a lot of women with mastitis and breast abscess tend to be also overproduced mom. What do you call by overproduced mom? Mothers with too much milk. I know it's very nice to overproduce and then also very nice to let everybody know you have so much milk because that reduces a lot of your stress. You know, your mom won't stress you, your mother-in-law won't stress you, nobody stresses you, you got so much milk, mom. But try not to overproduce. So overproduced mom, how does it happen? It usually happens during the confinement because the first 1 week, after about 7 to 10 days, you actually got a lot of milk. After the first 7 to 10 days, when you reach the peak of your milk production, you actually got a lot of milk. And some people at that time, wow, they very gung-ho, man, they pump. Then they maintain so much. So usually the milk supply go up. Then it will actually come down a bit to meet the demand of the baby and then it stabilizes. But then when it comes up, and then you keep pumping, you don't let it come down. And that is when you become an overproduced mom. Overproduced mom also tend to have more blocked duct issues because you can never feed finish. Your baby, even direct latch, cannot finish. So you depend a lot on pumping, and then if your pumping is not efficient, then you end up a lot of blocked duct as well. So these are the situations that I noticed most of my mothers who come to me at the stage of breast abscess. What are the things that make them have breast abscess? So back to earlier, what I told you all, if you see one lump hardening, after 1 to 2 days, if it doesn't go away, don't think so much anymore. Start on antibiotic first before you still try to clear the blocked duct. You start antibiotic first because we don't want you to get mastitis. Because if you start antibiotic early, before mastitis, you also don't need to take so long antibiotic. Maybe just 5 days will do. Because you are still working on clearing your breast milk, within 5 days, it will be all over. But if you already come to us at the stage of mastitis, then we need to give you 10 days, at least 10 to 15 days of antibiotic. Then you need to take longer antibiotic. So 1 to 2 days of blocked duct, if you can't clear it, then you need to start antibiotics. After 2 to 3 days of antibiotics, if it doesn't go away, you must do an ultrasound scan. Okay? Don't delay. That's why I mentioned earlier, most of the women, most of the mothers who come to me with breast abscess, if I ask further as to why they have the breast abscess, there's always delay. There's usually either delay in starting antibiotic because they still think it's blocked duct, they're still working very hard to release the milk, but actually the milk already infected. Number 2, there is also the delay in antibiotics. Number 1, wrong antibiotic is another problem. So please, if possible, try and look for a doctor that works with a lot more breastfeeding mothers. That will keep you on the safe side because I do see mothers who come to me with the wrong antibiotic. And third is, they actually, when they go and see the doctor, it's already abscess. They went too late already. Maybe from the blocked duct, by the time they go and see doctor, it's 1 week already. So 1 week then you go and see doctor, actually it's already abscess. But because the doctor didn't do ultrasound scan, so the doctor give you antibiotic only, it didn't work. So you wait for the antibiotic to work, it didn't work. And by the time you come and see doctors like me, at the stage where you have the abscess, sometimes the abscess is really a lot already. Then when your abscess is a lot, we're not talking about 2 weeks antibiotic, you may end up eating 1 month's antibiotic. So very important is to start treatment early. Okay, very important, start treatment early. So what are the signs that tell you that most likely you already not blocked duct? As I say, blocked ducts, number 1, they're not painful. Number 2, there's no red color on the skin. If you see there's mild red color, it's abscess. Pinkish red on your skin, that's abscess. When it's really red, there's pinkish is mastitis. When it's really red, that is abscess already. So you're not supposed to see that. Blocked duct, the skin is still skin color. That area that is the block and the rest of the skin is same color, okay? And third thing is there's no fever. Blocked duct, no fever. Once you have fever, there's infection. Once you have pain, there's infection. Once it becomes red, there's infection. There's infection, you always need antibiotic. Always need antibiotic. Some people, they thought they were very lucky. After a few days, they managed to express everything out and over, but many, after another week, it blocked again. So actually one of the reasons is also because the infection is still there, the bacteria is still there, it hasn't gone away, so it will come back. So never. So basic rule, 1 to 2 days, block duct, not settle, take antibiotic. After 2 to 3 days of antibiotic, not settle, get an ultrasound scan. If you do that, you're on the safe side. So even if you have abscess, it is still at a very, very early stage. Okay? So if you need to see me for all these ultrasound, because for me, when you come to me, if we have a hardened, one patch hardened, we always do ultrasound scan. Because occasionally, the skin may not be red, but it has a very deep abscess deep inside the breast that we will miss because the skin outside is still normal. So I always do ultrasound scan for all my blocked duct mastitis or breast abscess, just to make sure that you are not having an abscess. Because as long as it's not abscess, I'm not worried, antibiotic will settle all problem. Okay, I'm going to go through some of the questions that you have. Joey, I found my left breast still have some red patches after 2 times of mastitis. Is it normal? There is no lump and soft, but the milk pump out is very little. May I know anything I can do to get back the normal quantity? Okay, number 1, she has mastitis. Mastitis or breast abscess by right, actually, even if they do reduce the milk supply, it's supposed to be temporary. But you must understand that stress itself also can reduce our milk supply. So sometimes going through the mastitis, the infection, makes a lot of us very stressed out during the time. That is why our breast abscess, our milk supply actually dropped. But now you have to concentrate to build back the milk supply. Actually, it's very simple. Go back a lot of latching. Very important. If you're direct latching your baby, it will come back. For people who are solely expressing, it will be a bit difficult to come back already. Because it's very difficult to increase demand if it's based on breast expression and only. So the only answer I can give you is go back. A lot of skin to skin, a lot of direct latching. Spend a lot of time with baby, skin to skin again. Skin to skin will do wonders, trust me. Spend a lot of skin to skin and then direct latch as much as possible, and it will slowly come back. Because when you skin to skin, baby tend to latch even if the baby is hungry. That's how, even if the baby is not hungry, the baby tend to latch back when you do skin to skin. So that is why we want to build back the milk supply. We need to let the baby latch as much as possible. Okay, I do not know what your red patches look like. Is it really the mastitis red patches or something else? But if it's soft and there's no pain and there is no fever, then I don't think there is any more mastitis. So I will still just watch it and see lah. But I really do not know what is your red patches. What do you mean by the red patch? Because I didn't see it. Okay. Yap Chin Hui asked how to prevent overproduced mom. Very simple. Overproduced mom is always during the first to second week of life of your breastfeeding journey after birth, when you pump too much. If you don't pump at all, you will never be overproduced, because as I said, the milk supply go up and will come down and meet the demand of the baby. So don't pump at all, then you will never be overproduced. Spend the first 1 month of your confinement, direct latch only, don't pump, then you will never be an overproduced mom. But if you pump, then you have a tendency of becoming overproduced. But also depends on how much you pump. So sometimes I do encourage mothers to pump at that time, but just pump 1 bottle a day lah. Don't pump empty. Don't. Just pump 1 bottle a day to keep enough for you to go back to work next time after your confinement. Then the rest of the time, just direct latch. Even if your breast is full, just direct latch. Let it be. Your milk supply will come down to meet the demand of the baby, okay? Okay, June asked, is there a reason why the blocked duct keep coming back, yes, number one, it is still because of infection. Most likely there's still some infection inside that you haven't cleared, so what you need to do is take antibiotic. Number two is the reason why it keeps blocking, maybe got to do with the way you express your milk. Like I mentioned earlier, maybe your clothes always locked in the same place. These type of things can also cause the duct to be always locked back at the same place. But infection is another thing you need to consider. And please drink more water, okay? Drink more water. Because you need to have more water to be able to flush everything out. Okay, I really mentioned that this breast pump looks convenient and tempting, however very worried after bought online, found out not suitable. I think if you find it's not suitable, maybe it's best that you will look for the company people, because I did try the breast pump on myself and I feel that the suction is actually quite good. But maybe there is some reason, maybe the size of the accessories may need to change, so I think it's best you go and look for the supplier themselves. Okay, so mentally ask how to stop breastfeeding safely. How to stop breastfeeding safely is very easy. Don't stop lor. Let the baby decide when to stop. That will surely be safe. Okay, that is the safest way to stop breastfeeding. Let the baby feed until the day the baby decides to stop, because the baby will reduce the breast milk intake as the baby grow older. Actually, babies when small, they feed very frequent. By 1 year old, maybe they only feed 3 times a day, 4 times a day. So slowly they will reduce. So they reduce, our milk supply also reduce on its own. So then that is the safest way of stopping breastfeeding. You have no issue about any problem at all. Amy Muhammad asks, a patient early 20s, not married, complained left-sided axillary swelling and on ultrasound. Oh, this is nothing to do with breast abscess. I think it's best to see the doctor. Let the doctor decide what's wrong, okay? Alright, we have to see the patient, cannot just ask like that. So she has to see me before I can comment further. Yafen asks, I'm slightly overproduced. I always have blocked duct. It is like every 2 to 3 days I will have blocked duct, even though I latch 70%, pump 30%. Is it due to food intake? No. Think about how much water you're drinking. Think about the way you are pumping your milk. Is there anything that is blocking the duct when you pump the milk? That's another thing you need to do. And if you have blocked ducts, have you ever covered yourself with antibiotic? Maybe there's still some sort of infection inside, that is why it's always blocked. Siti Fatima asks how mastitis can come back when it's already past breastfeed 2 years back. It can if there is infection. Actually, mastitis can even happen in non-breastfeeding mothers, and also in abscess also can form in non-breastfeeding mothers. But usually there's still some form of infection. Either you have a wound or an injury around your nipple. For example, you can actually have a pimple at your nipple, and that can also cause infection inside. Or maybe your breast nipple is a bit inverted, so there's a lot of, sometimes it can accumulate a bit of dirt inside. And all this dirt inside can actually also cause mastitis. So you can actually have mastitis even though you have stopped breastfeeding. Pink Lau said that she has been breastfeeding for 7 months now. I realized I can't wear bra for a long time. I keep getting blocked duct. I'm already wearing very loose bra. Is it normal? So sometimes you may think your bra is loose, but when your breast is really engorged at times, sometimes there is still a certain compression. And I also realized that it also depends on what kind of bra you buy. Sometimes a bra, when you open it up, there is a hole here, right? So actually this hole here is also an area of compression. So I usually advise mothers not to buy that kind of bra. When you pull out, it should be totally, the breast is free. When you open, it should be totally free and not with a hole in the middle, okay? So when there's a hole in the middle, then it can still, you feel it's loose, but when your breast is engorged, when your breast is full with milk, then it can actually still be a form of compression. Okay, so yeah, that's right. Bra sometimes it's still, the bra, the clothing, all this can affect blocked duct. That is why if you think about our old mothers those days, in the kampong, they breastfeed, they most likely also don't wear bra the whole day. Actually, they got less problem. Yes, they wear loose clothes, they don't wear bra, they actually got less problem. Joan Liao asks, drinking less water? Yes, because your milk will be not enough water. You must understand that your milk can be watery, your milk can be thick. Thick milk very likely also to block. It's just like the first week of life, first week of baby's life, when you first week of breastfeeding a baby, you have colostrum. Colostrum also like to block the duct because the colostrum is very thick. So if your milk is very thick, not enough water supply, then you can also form blocked ducts. So always drink a lot of water. Water is the key thing. JYE asks, I just gave birth 5 days ago. She's my first child. I realized my limb near my armpit is swollen. That is normal. I think I'm a bit oversupply. I use hot water and massage few times a day. Can this help? Of course it can help. It helps in relieving lah. Let the milk. Hot pack is to help the milk to come out. Soften your breast to help the milk come out easily. But it doesn't help in reducing the milk supply. But it can help in releasing the milk. But if you think it's painful because your armpit area is painful, then that one we should actually use cold pack. But whatever it is, you don't have to worry. All this will go over one. Okay, it will go over one. Yafen asked that I know I shouldn't empty my breast since I am slightly overproduced, but I'm worried if I don't empty my breast, the duct will block. How to balance this out? Yafen, if you are a total direct latching mother, you don't have to worry. You have to direct lash lah. Direct lash maybe will unblock the blockage one. You don't worry one. Most importantly, you need to direct lash more than pumping. Most important. As I realized that I get blocked duct during menses. Any reason for that to happen? Yes, partly it's because your water supply has come down. Because you must understand that before menses, we actually have a lot of water retention in our body. So now our body is fighting with the breast for the water. So your water supply has come down. Take good care. Remember all the things I told you. Blocked duct 1 to 2 days, antibiotic 2 to 3 days, ultrasound. Okay, that is the main thing you need to remember forever and forever, because even if you have blocked duct mastitis, antibiotics solve the problem, it's not a problem. It's just we don't want you to end up with breast abscesses, okay? Thank you. Thank you for watching my video today. As usual, next Sunday I will come up with another topic, and a couple of days before that I will post up the topic on my Facebook. If you have any interesting topic that you think that will be interest to a lot of people, you can always write it in the comment below in this video. Okay, I will go through the comments and I will see if you have suggested some interesting topics. I'm more than willing to put it up in my live video. Or you can even put your story there, and hopefully that I can actually quote your story and use your story as a health education for the rest of the people with a problem that maybe your story can help a lot of people in solving their problem as well. So it can be either a general topic, or you can actually write up your story and put it below my video in the comment section, so that if I think that your story will help many people, I'm more than willing to do that topic for you. Okay, so that's all for tonight. Thank you. Bye bye. Stay tuned next Sunday. Bye.